Yeah, so like I said, there's a completely different concept between a public health intervention designed to prevent hospital overwhelm and the intervention to protect the weakest person. These are not the same concept any more than the school plan for average kids is not what's best for the weakest child. What is true is if you handle the many and prevent them from getting as sick, that indirectly benefits affects the weakest people who are not going to suffer triage. Where it's like, oh, you have cancer and your life is worth less than this 40-year-old guy who didn't take a vaccine, right? That's what they do. That's literally how it works. So they indirectly benefit from those things, but they're not tailored to protect the weakest person, which is what the liberal is thinking, right? So now you get this stupidity of universal mask always. Don't be selfish, care about the weakest people. And it's like, those interventions were not what is best for the weakest people. Those people were told, stay the fuck home. Do not go out. Just don't do it. COVID's really high. Those interventions were to prevent hospital overwhelm that would indirectly hurt the weakest person. Does that make sense? So here you have liberals misunderstanding science while calling themselves the party of science and then chastising everyone because it sounds nice. This is what I mean. Like the way liberals and progressives decide things is whoever screams the loudest, you're mean. You're being mean. And then they're just like, yes, we have to obey this. That is literally how they made MAGA. Like, whoever screams the loudest, this is the way to go. And if you don't believe so, you're a fucking pansy libtard. And then they're like, yes, we're not going to take vaccines anymore. Like, as a nurse, I shouldn't even say as a nurse because I don't mean shit. As somebody educated, I look at this like, you're just literally demanding universal masking. Your logic being it protects the weakest person directly when you don't even understand why we did that and how we implemented it. We coupled it with mandatory social distancing as well as any unnecessary venues that are overcrowded and high risk where it's poorly ventilated and people are close together were just not an option to go to. So in that case, it's effective because the risk is already lower and then the masks in transient interactions with social distancing and no cycling air that is contaminated with COVID, now you're getting somewhere and you're reducing number of hospital overwhelmed cases. And the only benefit to the immunocompromised, who are frankly told stay the fuck home, is that they're not likely to be victimized by a triage situation where all the fucking 40-year-olds who didn't take their vaccine get prioritized over them and they get told to wait in the waiting room. That's how it helped them, not directly. So in a post-pandemic society where we're not in a state of hospital overwhelm, making immunocompromised people have a false sense of security that they can go to a club while they're on transplant rejection meds or cortisol for whatever, cancer and stuff. And they think if the guy next to them has a cloth mask and they have a cloth mask, they're safe. That's not true. It was never designed to be true. And by the way, during that time, they would have literal air purifiers. You know that, right? Like a lot of big places that were really doing it right. They had air purifiers where they knew it was a closed, ventilated place. HEPA filters, such things. Because of the fact that they knew this is airborne. Anytime there's a bunch of different people close together recycling the same air with no ventilation, you're going to get sick. The cloth mask will not help. And they had literal, I remember, which what's funny again, because I was a nurse during this, when my facility finally got those filters, I felt such a reduced immune response. Like I mentioned this, like I literally developed like a COVID warning system. I got the first strain ASAP because knowing what I know now, and I'm hunted by the Illuminati, they made sure of this. The first case was the hospital right next to my job, so I got it like before anybody. Knowing now that wasn't a coincidence. So because I got the first strain really bad, no vaccine, I got more sick than I've ever been in my life that I can remember. I developed this really weird immune response to COVID where I wouldn't get sick again because I was exposed to it so frequently. But I would get like this bevy of malaise from immune overactivity. Like I'd get crushing chest pain. I'd like be coughing weirdly, probably from I would suspect from inflammation from my immune system freaking out upon COVID exposure. So I'd immediately start coughing and I feel like fluid in my lungs and I get crushing pains. Again, I speculate these are all my own immune system now that it's sensitized to COVID and can neutralize it, just causing this hyperactive immune response. And so when I was working, I always felt like shit because you have to go to the COVID wing and, it's just, you don't have supplies. And as soon as they got them air purifiers, it was like I could breathe easy, right? Like, because the level of COVID in the air was just lower now, right? Yeah, so what I'm trying to say is this is one of them things where it's like liberals is just like MAGA. You don't even know why this works, why it was implemented, how useless it is in a post-pandemic society where people are like, welcome to the club, fuck ICE, yeah! And everyone's together screaming and it's a fucking closed place and there's no ventilation and you could smell, it's one place you could smell the body heat, you could feel the body heat. If you're an immune compromised person, you shouldn't be there, first of all. But if you are going to go there, you're going to need a KN95. And I can't get fit test. Like, dude, just buy large, medium, small. Put that shit on. Make the seal fit. Make the seal fit around the nose, over here. And then get something to spray it. I can't taste. You're good. That means you can't get COVID either. That's all you gotta do. I've been fit tested. It's not a complex procedure. You just put the fucking mask on, make sure you got the seal right. You'll you can't see your air, and then they'll spray bitter, sweet, and I don't taste it. This shit ain't rocket surgery, and it's based on your self-report, so you can do it yourself. But what you shouldn't do is listen to these dumb MAGA liberals where they're like, "You're a fucking fascist because you don't care about the sick. We want to have our ICE concert where we say fuck ICE and everyone screams together." And you should be fucking persecuting the people with cancer and multiple sclerosis and transplant. I'm like, no, I'm just educated. That's actually really bad. You're giving them a false sense of security. And universal masking to prevent airborne spread was never designed for this. It was coupled with places like that shut down, with being told the vulnerable don't even go there at all, with social distancing, with only necessary places. And then you're hoping, this was the whole point of the public health intervention, that cases don't spike enough that hospitals shut down. It's absolutely not what's designed for the weakest person. So again, it's just literally, this sounds nice and you're a Nazi if you don't agree. It's like a lot of things, like you try to argue with them, they just call you a Nazi. It's like, bruh. This is why I say MAGA is literally what they did to progs already. Unthinking, conformist, the loudest person's right. If you don't agree, you're an enemy. Like, you can't have a discussion on them with trans policy. Like, you fucking hateful bigot piece of shit. It's like, I can't. Like, but with stuff like this, where it's infectious disease, where the data is solid, it's like, you're just literally wrong. This is actually a false sense of security that is putting people in danger. And yeah, that is not what should be advised, because if anything, you're going to give like people who normally would have avoided places like this, they're going to think they can go in now. And if you want to make those places more inclusive to people like that, there should be a public health push, like wear a good mask for you. And maybe, and even better, rather than having people wear universal masks, legislate any crowded place needs one of them air purifiers, because that will help a lot more than making a bunch of people in a place like that wear masks that are surgical masks that are never designed for airborne spread. So, yeah,